Hey, this is Zach Armstrong again. Thank you for checking out the next video, and hopefully you've watched the previous ones about the intro into what I'm doing here, and also about my own diagnosis of B-cell lymphoma. This one, I'm going to actually talk a little bit more about treatment, chemotherapy, radiation. I was diagnosed in December of 2009, and so I started chemotherapy January 2010. Initially started with going to have a port placed. I had nice little bump in my chest that would get my infusions through. I had treatment which is relatively standard for lymphoma, which is called CHOP or R-CHOP, the variation. It's an acronym for the medications I use: cyclophosphamide, doxorubicin, vincristine, and prednisone. And then the R is for tuximab, which is an antibody they infuse you with. And so I did 6 rounds of that, one every 3 weeks, starting in January 2010. And for the most part, I would say that I was very fortunate in my treatments. I didn't experience complications during my chemotherapy. It's not fun. I'd sit in a room at the infusion center for about 8 hours once every 3 weeks, and Kristen would come there and sit there with me. And there's not a lot on TV during the day during that, so we watched a lot of Discovery Channel and the crab boats, which I thought was entertaining at the time, although I think it annoyed her. The treatments are different, I guess is the best way to put it. They basically cycle medication through you one after another, infusion-wise, and it is you get sick to your stomach. The nausea was not fun. Typically, the day I'd go in for a treatment, I wouldn't feel so bad. The next week was not great, however. You get a lot of nausea. You take the infusions there, but then for the next several days after that, you take very high dose prednisone, which is a steroid, which you think, oh, that's just, lots of people take prednisone, but you take very high doses to a point where that would kind of make me sick as well. You get very jittery. I didn't sleep well. And oddly enough, like during chemotherapy, combination of the prednisone, I think I actually put on weight, and I think I gained about 20 pounds during that time period, and which is kind of the opposite of what people expect when you go through chemotherapy or cancer treatments. About round 2, my hair started to fall out, and we kind of acted proactively. And when the first day that I had some fallout, I just decided, let's cut it all off. Let's get rid of it. I'd rather take that control of that and have that as what we did as opposed to what it did to me. I couldn't work during this time period because I'm a resident at University of Louisville Hospital at the time. It's not safe for me to be in the hospital around sick people when I'm undergoing chemotherapy, because I've gotten a compromised immune system. So, I go from school, med school, residency, to not being able to do anything. That was very difficult for me. I had to spend a lot of time sitting around watching TV, reading books. There's just not, you got to kind of entertain yourself and through a lot of it, and that was frustrating for me. I kept begging my supervisors to let me come in and do something in the hospital, but they were very smart in looking out for me, and thankfully said, no, I think it's probably better if you didn't, even though I continued to ask. So the things they don't tell you about chemotherapy or anything like that is that once you have a port in and they start infusing things through it, everything tastes different. You can taste everything they infuse. It's kind of odd. Certain things all of a sudden make you taste salt water. Some things taste kind of bitter, and kind of ruined Qdoba for me. As a result, I would get Qdoba burritos every day when I was getting chemo all through all 6 treatments, and then didn't think about that at the time. Afterwards, it would subconsciously, you just go into Qdoba, I would associate that with chemotherapy, and I would get nauseated. It took me a long time before I could actually go back into a Qdoba, but thankfully it's back. I can go back. But we did that for 6 treatments. Did very well. I didn't have a lot of issues, and we got a CT scan after the treatments, and it looked like the mass had resolved, and that was great. Now, because of the size of the mass that I had in my chest, they recommended that I go through a month of radiation as well, which was a different kind of treatment. If you're not familiar with that, basically this is like high-powered X-rays. They're shooting at the area of the mass to try and clean up any straggler cells that could be there. So this was a little different. I went every day for a month period, and I'd go in, lay down on the table. They'd have a big mask that fit over my head and shoulders that kind of locked me into the table so I wouldn't move. So they were always shooting the X-rays at the same spot, and I did that every day. It took about 15 minutes, which wasn't much, but I actually had a much more rough time with radiation. Because of where they're shooting, they're aiming into my chest, which is where the cancer was, but it also hits everything kind of around that. So I had a lot of issues with reflux and esophagitis and a lot of pain in my chest. It was not a fun endeavor. I really hated radiation, and I'd gained a bunch of weight from the steroids during chemotherapy. I lost every bit of that during radiation because I kind of just stopped eating for days. And it's that was mentally, radiation was much tougher for me. Although it was a much shorter period of time, it weighed on me a lot more mentally and physically than chemo ever did. And thankfully, Kristen was there with me through all of it, because there were a lot of days I would wake up and I was like, I don't want to go today. I don't want to go. Yeah, it's okay. I'll feel better. I won't need to go. And she, helped push me through that. And afterwards, this was the end of May, beginning of June of 2010. Everything looked great. Was declared that I was in remission. Went through some follow-up scans, which didn't show anything, and still to this day, I'm very fortunate that I haven't had any kind of any issues long term with it. So that's where I am. That's what chemo was for me. Radiation was for me. I was very fortunate in my own personal story. I didn't have complications. I didn't have to spend a lot of time in the hospital. I wasn't away from my house. I wasn't away from home. I had my own creature comforts during my personal battle. It's not in the way it goes for everyone, and so I was very thankful for that. But the effects of it, I think, have lasted longer than you think. Just mentally and in your home life and the way things go from there. And I'll talk a little bit about that in a follow-up video here. But like I said, once again, thanks for tuning in. Thanks for listening. Like I said, donate. Every dollar is going to go to research, help support me in this. And remember, if you work for any organization, there's a drop-down menu on the donation screen that has matching donations. If you work for any of those corporations, please click on that, because they will match, and you can your donation just gets doubled or sometimes even tripled depending on what organization you work for, and you have a bigger impact. So thank you again for this, and please remember to donate.